I think he is very quick and smart, and you can tell that he's been doing this for a really long time. He's super, easy to work with and explains everything. I think one of the things I was impressed with was the x-rays that he did on my first consultation appointment, and actually showed me where my jaw bones have been grinding on each other all this time, what that would look like in the future if I didn't start getting treatment now at such a young age, to have my jaw grinding on each other like that. So it's pretty scary, but he made me feel comfortable and knowing what the process was going to be like, how long it was going to take, and just really what I can expect. I think what he has set up here at his practice makes it really easy for patients to get this kind of treatment, having all the x-rays in-house at the office, and really everything run through his practice makes it easy, whereas other ones you have to go in for a consultation and then set up a time to get the x-rays and then come back into the office to review the x-rays. So having everything here just made it a pretty quick and easy process to really figure out and get started on treatment. Well, I am 26 now, and I remember when I was a freshman in college, so I was probably about 18 or 19, that's when my jaw started clicking, and I would be eating, and if it was quiet, people could hear it. They'd say to me, is that your jaw clicking right now? And I'm like, yep, yeah, I don't know what it is. And back then, it never caused any pain. It just was an annoying sound to me. But later, after I graduated college and I was working, and I noticed times where I started getting stressed at work, or it was a heavy week, that's when it would get really inflamed and it would be tight on the sides. So I knew that this was more serious than just annoying jaw clicking. Started feeling like I had ear infections just because the middle ear was so inflamed on one side, but going to a doctor, they'd look in there and say, nope, there's nothing in your ear. So yeah, symptoms for probably about 6 years, they just started getting progressively worse. So I knew that I needed to take care of it. And it's definitely starting to heal. I've noticed the clicking in my jaw has minimized. It's almost now I have to, if I want it to click, I kind of have to find it and force it. It's not happening naturally like it was for so long before. So I'm only about 3.5 weeks into treatment, and I've already noticed a difference, kind of past the initial inflammation of it trying to realign itself, but I can tell that it's getting progressively better.